Hey, does your partner snore? It's one symptom of sleep apnea and maybe something you should look into. We're here at Trinity Health talking about sleep apnea. And we've got the expert, Dr. Morgan, right here, who knows it all inside and out. Thanks for spending some time with us, Doctor. Appreciate it.
Thanks for having me.
Sleep apnea. Let's just define apnea. What does sleep apnea mean?
Yeah, so sleep apnea means when you stop breathing when you're sleeping at nighttime. And this can lead to your oxygen dropping at nighttime and waking you up during the night and causing restless sleep.
So what kind of symptoms are we talking about? I mentioned the snoring. I mean, everybody kind of associates that with, oh, maybe you got sleep apnea. But you said you're not breathing. Maybe you're gasping, catching your breath. Is that a symptom?
Yeah, so partners may notice that people will wake up gasping, choking, but it's not always that simple. Sometimes it's just a little bit of light snoring, and trouble with sleeping through the nighttime or insomnia are very common symptoms. It can also affect how you feel during the day. You can feel tired, have mood changes, and overall just not feel refreshed when you wake up in the morning.
Well, getting a good night's rest, we know, is key to health. So let's get rid of that sleep apnea. How CPAP is the thing that everyone's heard of, right? I'm assuming CPAP is one of the treatments?
Yeah, CPAP is still the gold standard for treating sleep apnea, and it is the best treatment we have, and the technology's come quite a long way to make it as comfortable as possible for patients, and we do a pretty good job trying to coach patients along through that, and the vast majority of people can tolerate CPAP and do well with it and feel much better with it.
And describe what someone is doing before they're going to bed at night with a CPAP.
Yeah, so with a CPAP, it uses air pressure to open the airway, so they have to basically just get things ready. So there's a machine that generates this air pressure, and that's connected to a mask that you wear when you sleep at nighttime. Mm-hmm. Most masks are pretty small that fit under the nose or over the nose, and they have to just place that on when they go to sleep and turn the machine on, and that's it.
And that's all you have to do. But there are other ways to treat sleep apnea beyond the CPAP. Can you talk about Inspire?
Yeah. So I mean, nationally, there's about 50% of people struggle with CPAP. It's a little higher, a little less with sleep centers, but there are alternatives if you haven't done well with something like CPAP, including the Inspire therapy, which actually stimulates the tongue to open your airway. Yeah. So it actually pushes that tongue forward and keeps the airway open so that you can breathe at nighttime.
Okay, so what in the heck is making my tongue getting pushed forward while I'm sleeping? Explain this Inspire.
Yeah, so it's a surgical implant. Actually, I have a couple little props here. So it's a little implant about this size, okay. And it goes under your skin, usually on the right side here, and then there's a wire that runs up that stimulates a nerve that pushes your tongue forward when you sleep. And you activate it with a little remote like this each night.
So you have a remote control. Mm-hmm. I love the technology that they have. All right, besides Inspire, the CPAP, are there any other ways people are treating this?
Yeah, so there's oral appliance devices where a dentist can make you a device to help pull your lower jaw forward to open the airway. That's a very common alternative that we use. And then you may have heard of a new medication that got approved to treat sleep apnea called Zepbound. Or tirzepatide.
Tirzepatide, right? Yeah,
name, yeah.
Right.
And this helps treat sleep apnea by helping you to lose weight. It's a weight loss medication. So
weight loss can help treat sleep apnea as well.
Correct.
Are there any other holistic ways that people can, obviously they're getting the treatment here at Trinity. What about at home? Any diet or any type of exercise? I'm assuming all of the standard good exercise and good sleep are going to help with this, right?
Yeah, so, apart from the medical treatments that we have, healthy lifestyle, trying to lose weight through diet and exercise can be important for sleep. Staying on your side or off your back may help, or elevating your bed a little bit may help with snoring and sleep apnea to some degree as well.
Excellent. I'm sure there's a website that has all of this info waiting for me too, right?
Absolutely.
TrinityHealthMichigan.org/apnea. I'm going with sleep apnea or sleep. Let's go with sleep. Yeah, that's a good hashtag. TrinityHealthMichigan.org/sleep for more. You can get all the information that you just heard Dr. Morgan and more waiting for you online.